Folks, Nick the Nurse here. Today we're going to be talking about some of the nursing diagnoses associated with the patient who might have DVT or deep vein thrombosis. DVT is a disease that, or nursing problem that frequently comes up on nursing school exams and might even come up on the NCLEX. So you need to make sure that you know about the nursing diagnoses that might come up when both formulating your care plans or on a nursing school exam or the NCLEX. So that's a little redundant, but you get what I'm saying. Anyway, one of the big things that you might see is ineffective tissue perfusion. You need to be able to address that in your patient, talk about how you're going to fix it and how you're going to evaluate it. Also, impaired physical mobility. If somebody's calf is swollen up to about twice or maybe even just 50% of its size, it might be hard for the patient to move around. You want to make sure that you address that in the nursing care plan. Risk for ineffective breathing pattern. Why? Because a patient who has DVT is at risk for what? Pulmonary embolism. And we want to make sure that we avoid the patient developing a pulmonary embolism. Why? Because it's deadly. Kind of scary, huh? We want to make sure that we stay away from that, and we as nurses have a tremendous amount of power to make sure that we put preventative things into practice in the care plan to ensure that they don't develop them. And some of those nursing interventions we talked about in our video on interventions. So you can go back and review that if you need to. Acute pain, we said that acute pain might be one of the signs and symptoms of a patient who has a DVT or deep vein thrombosis, so we want to make sure that we address that either with pharmacologic pain management like morphine, Vicodin, what have you, or we can use non-pharmacological remedies like meditation, things like prayer, distracting the patient, stuff like that, guided imagery. There's a lot that can be done, okay? And those oftentimes show up on nursing school exams and possibly even the NCLEX. So you want to look out for stuff like that as well. Risk for impaired skin integrity. If the DVT does expand, the leg does expand enough, you can certainly have breakdown of tissue and skin, so we want to make sure that we watch out for that and put a good care plan into place to address it. And also the patient might have ineffective health maintenance because a lot of times patients who are at risk for DVT are immobile. So we got to make sure that we put a care plan into place to not only ensure that they don't develop DVT, but if they have a DVT, that we prevent them from getting another one, right? Because we want to make sure that we don't have history repeat itself in this particular instance. So anyway, those are some of the good nursing diagnoses that you can associate with DVT or deep vein thrombosis in your care plans as they come up on nursing school exams or perhaps even on the NCLEX. My name is Nick the Nurse. I want to thank you for watching this video. If you'd like to check out any of my other videos, they're completely free, no obligation, you don't have to buy anything. You can check them out at www.nickthenurse.com. Again, thanks for watching, and hopefully we'll see you next time.